A sudden passing shocked Hollywood and fans around the world. Now a local doctor is weighing in as Chadwick Boseman's death puts the spotlight on colon cancer. In today's Health Smart, the tragic death of actor Chadwick Boseman is shedding light on a troubling trend, the increasing risk of colon cancer in young Americans. The Black Panther star was diagnosed with stage 3 colon cancer in his late 30s and battled that disease for 4 years as it progressed to stage 4.
His death has raised so much awareness for the third deadliest cancer in the U.S. And joining us now, we want to bring in live via Skype Dr. Petar Vukasin, Medical Director of the Colorectal Center at Dignity Health Glendale Memorial Hospital. Doctor, thank you so much for joining us. We appreciate your time.
Thank you for the opportunity to speak on this important subject.
So important. He was so young. Colon cancer is on the rise in young adults. So can you talk about the increase in cases, and do we know what's pushing that forward?
Yeah, it really is a trend that we've been noticing for about the last 10 years. About 2 years ago, we figured out that people in less than 50 years of age are having a tremendous increase in rates of colon cancer. It's actually going down for the population as a whole. People who are over 60 are seeing much less cancer. But younger people, it seems to be on a rise. We're not really sure. I'm sorry?
Who is the most at risk?
There's a few groups of people that are very much higher risk than the general population. Mr. Boseman's case, as unfortunate as it is, points out some of these risk factors. We're finding that younger people, especially under the age of 50, seem to be having an increase in the number of colon cancers that are found. We're not really sure why. It seems to be, some people think it might be related to the obesity epidemic that we're seeing, but it certainly is other factors as well. The other important factor that brought out with Mr. Boseman's case is that the African American community is much more prone to colon cancer than the general population, about 20% more likely to get the disease.
From what I understood, colon cancer is pretty curable if you catch it. I guess that's a big if. So how does that part of this work?
Yeah, it is a disease that we cure for the most part. Across the board, if you're diagnosed with colon cancer, you have about an 80% chance of getting rid of it, especially in the earlier stages. The cure does require some work. It requires a combination of chemotherapy, radiation, and surgery usually. But again, we can cure most of it. The earlier we catch it, the more likely we are to cure it. Stage 1 and stage 2 have very high cure rates. In Mr. Boseman's case, unfortunately, he was diagnosed at stage 3 when it already spread to some of the lymph nodes, and it did not respond to treatment apparently and did advance to stage 4. The trick to this disease is to catch it early and treat it. But even more important is to catch the precursor to the colon cancer, which is the polyp or growth inside of your colon that with time can go on to become cancerous. And that we catch through screening and being aware of the symptoms and signs of something possibly going on.
So at what age should those screenings start?
Yeah, as the population of colon cancer is getting younger and we're seeing more and more patients in their 30s and 40s and even in their 20s, we think that the screening should start sooner. The typical recommendation is at age 50, but the American Cancer Society and a few other societies have actually lowered that age recently to 45 because of these younger patients that we're seeing. So anybody age 45 or 50 should have a screening colonoscopy to try to find these precancerous lesions and get rid of them. If you have symptoms that indicate you might have a cancer or a precancerous polyp at any age, and those symptoms are bleeding with bowel movements, unexpected weight loss, tiredness, or any other thing that might worry you, family history, anything like that, you should speak to your surgeon or speak to your physician, I should say, at any age and see if you're appropriate for screening.
There's been some talk about meat being linked to it or things like that. Is there any recommendation around what people eat?
Yeah, diet seems to have a big impact on colon cancer. We certainly know from numerous studies that high fiber, low fat diets are more beneficial to preventing cancers. Minimizing the intake of red meats seems to be beneficial as well as charred foods. Burnt food on barbecues seems to have a higher impact on colon cancers. There are some other dietary factors also. Vitamin D has more and more evidence may be beneficial in preventing the disease from happening.
All right, doctor, with some good advice. Colon cancer, it's one of the toughest cancers out there. We certainly appreciate your insight.
Thank you very much for the opportunity.
Thank you, doctor.